Okay, so hi guys, I'm Bailey, and Morgan and I are here to talk to you guys today about a disease called hypoparathyroidism.
Hypoparathyroidism is a big word, so I'm going to break it down for you guys. Hypo means too little, para means disorder or dysfunction, and thyroidism is the disease itself.
So, this is a disease where the body produces abnormally low levels of parathyroid hormone, and this leads to low levels of calcium and phosphorus in the body. And PTH or parathyroid hormone regulates the balance of those two minerals in the body, calcium and phosphorus.
Okay, the etiology. There are a few things that can cause this disease to arise in the body. People who have very low magnesium levels, sometimes that's based off what you eat, but since there's low PTH, that lowers your magnesium levels. If you have had or do have autoimmune attacks, as well as other autoimmune diseases, that can cause you to have this disease as well, just because those with autoimmune diseases tend to have multiple or can get multiple, or if you've gone through radioactive iodine treatments.
Okay, so there are several signs and symptoms that can show the possibility of a person having this disease or developing this disease. And those include like a tingling sensation in the fingers, muscle cramps throughout the body, really dry skin, like patches of dry skin, your hair turning coarse, and then a lot of like mood changes and kind of just like behavioral new changes in your body that you start kind of acting differently, you kind of like have mood swings, stuff like that.
Okay, so treatment. Most of the treatment for this disease are supplements or pills. Oral calcium is a supplement you could take. It's probably going to be prescribed, so probably something a little bit heavier than what you would get at like a Target or Walmart. Same with vitamin D supplements and magnesium supplements, just because the PTH lowers those levels, so it's important to keep those up. And then hormone replacement therapy, which will replace the fact that you have low PTH levels, so it'll increase those to the normal level that should be.
And then while anybody could contract this disease, it's definitely more possible for certain people to get it. So it's going to be people who've had damage to the parathyroid gland. It could really just run in your family. So in your genetics, there could be something wrong that causes you to have a really low level of PTH. And then having another autoimmune disease is going to make it really susceptible to getting this, just because your immune system really can't fight back and it's not acting how it should.
And then about the damage to the parathyroid gland, I read a story where this guy had trauma to his thyroid and parathyroid. So he had to undergo like surgery and procedures and stuff. And that also increases your risk for literally anything, any disease, any infection. So having trauma, probably if, I don't know, if you were hit or stabbed or something in the throat, you could be at risk for several different infections or diseases as well. Okay, and then here's some of our pictures. So this one over here is of lab results. So the hypoparathyroidism, the levels for the parathyroid hormone were obviously low. And then these are also other diseases that are commonly confused as hypoparathyroidism. So if you go to the doctor, they'll test for a bunch of things, just because some of them have similar signs, symptoms. The phosphorus can be elevated, and the hydroxy vitamin, I think, is normal, as well as, gosh, the dihydroxy vitamin. And then this other one over here is of the parathyroid glands, which your thyroid glands are this right here, and it covers your trachea, or it goes around your trachea, and then the back is your parathyroid gland, which this would be your spine, so the back of your neck with the